This is Your Health, a podcast of the Integrated Health and Social Services University Network for West Central Montreal.
Hello, I'm Peter Anthony Holder. Welcome to this edition of Your Health. According to Statistics Canada, approximately 2% of Canadians aged 15 years and older reported having a learning disability. While that percentage number is low, that still represents over 600,000 Canadians, and it doesn't include any of the numbers of those who may be under 15 years old. Learning disorders are a concern, especially at the start of a new school year. Dr. Ashley Wasana is an associate professor at the Centre for Child Development and Mental Health at the Jewish General Hospital. Dr. Wasana, by definition, what constitutes a learning disability?
So learning disability is when a child is having trouble acquiring in various different domains of learning, whether it's reading, writing, mathematics, the potential which we know them to have. So a child would have, for example, been tested, identified to have reasonable intellectual capacity abilities, but is really not able to learn at the level which is anticipated from their abilities. And that is as a result of difficulties in learning that aren't explained by other factors. For example, you'd have to rule out other factors like child having a problem with their eyesight that hasn't been corrected, or with their hearing. They might even have a severe attention deficit, hyperactivity disorder that hasn't been treated. They might not even had a chance to go to school because their behavior is so challenging that they're not even able to stay in class and learn enough. So we also have to have a child that has had proper exposure to the classroom environment and learning experience to say that they are not able to learn what they are being exposed to.
Are there warning signs for the parents, something that they can see early on, or is it only something that manifests itself once the child gets into a school environment?
I think in general, before a child ends up in school, they are in kindergarten, they are at home, and one of the first signs that you start to see is you notice that the acquisition of certain concepts are a little bit more challenging. The counting and the alphabet, sound recognition. These parents are often familiar from their other children, or other children that of their friends that they frequent or in daycare, that they're just not getting some of the foundations even before they reach school. That might be something that they could notice. And even a disinterest. Sometimes it's a simple as a disinterest. So the children might not have even the same pleasure with some of the concepts that are, sometimes we can have fun with children with numbers and counting and letters and the alphabet, and if you feel that this is something that a child is not even enjoying or having any curiosity about.
Is there a fine line between learning disabilities and a child that just develops more slowly? Because children don't develop at the same pace for everyone. So what is the lineage mark for that situation when you realize that maybe your child is just slower in developing as opposed to actually having a learning disability? So
that is a very good question, because they're actually a very technical definition. And the technical definition has to do with the gap, the magnitude of the gap between what is anticipated and what is achieved. So anything less than that gap is actually considered to be a delay. And so you could have, and these are in statistical term, that psychologists are very, familiar with, have to do with the distribution in the population, because indeed some people are taller, some people are shorter, some people are faster, some people are slower, and that also attains to learning. But we have something called measures of dispersion, which are called standard deviations, and in statistical sense, when you are more than 2 standard deviations away from the average, you are in the less than 5% of the population. So often we really set this cutoff at 2 standard deviations, so less than 5%, almost, actually it's 5% on both sides, so 2.5%, less than 2.5% of the population would have a score so low compared to what you're expected to have. So that really is, you'd have to really be very off the curve in order for somebody to establish that it is a learning disorder. Anything less than that, it could be considered a learning delay. So something one could think in the might be recoverable with more tutoring, with more exposure, with even understanding what are some of the matching factors inside the classroom that could, help a child optimize their learning.
Are there more cases of learning disabilities today than before, or are we just better at detecting them?
Yes, I would think we are just better at detecting. First of all, to detect, you almost have to have the resources you're going to offer. So one has to appreciate that historically it would be very painful to go and evaluate a child if you didn't think you could actually do something about it. So you also have to be in environments where there are even resources available. Once you have those resources available, then it's about identifying who actually should receive them. And so that has been a process that is very formal with psychological testing. We have to say that it is still a big issue in terms of obtaining proper, within reasonable delay evaluations in schools, because there are so many factors that leave children really be undiagnosed and unidentified. We are far from having a perfect ascertainment of all the children, but I have to say it is much better because people are being made aware, and we have now resources that are embedded within school structures.
And what are the resources available for those who have learning disabilities, and the type of work that you do in helping children with learning disabilities?
So, first of all, the type of resources are often even identifying, what is a learning disability that a child might have, and how that might have a direct influence on the child's experience of learning. So even knowing and naming and sensitizing everybody that you actually have a learning disorder means that one can start to help a child feel, first of all, understood for their challenges, even then accommodated in the way that the material is presented to them, and then also enriched in the manners that they are more effective in their learning, so that they start to have more positive learning experiences. And also helping parents not feel sometimes discouraged or negative about some of the slow progress that their children are doing, which they sometimes attribute to be, about the child's will, and motivation. And so when you start to have even a conversation with the child and the school and adaptation and a plan, already we can start to relieve some of the pressures and the tensions and the discouragement, all the factors which really, in the long run, can undermine a child's pleasure and desire to remain in school, or even to, perform and learn in manners that are positive. We have a program here where we take some of the children with some of the highest levels of difficulties in the school environment, behaving in their classrooms for various different reasons. And one of the first questions we have to ask ourselves is this a child who's really having trouble learning? And so the behaviors that are emerging, the anxieties, the worries, even the fighting, are really distractions and, downstream consequences of an undetected learning disorder.
Are learning disorders, or can learning disorders be something that is genetic? In other words, if someone is dyslexic, is there a chance their child will be dyslexic?
Indeed, that would be one component. I think we could be assured that in just about most of medicine, and we have some components which are familial, some of which are hereditary through genetic mechanisms. Some of them are also because the environments in which we live are also sometimes the environment in which we pass on. So it's always a combination, but we certainly have very good studies to show if you take two twins who have identical genetic material, there's a higher likelihood that if one has a learning disorder, that the other one will have than somebody that they're unrelated to, or even related to in the same family but not genetically identical. So there is some, but it really is not the unique component or principal component. It is, as we say, sometimes it is a cake, and it's hard to unbake the ingredients. But that might be one sign or one indication to be looking for that. If, for example, a parent has had a difficult experience in school. If one of the two parents had really trouble, they will tell you, well, school wasn't for me, I had trouble learning, I didn't get it, I got quickly disinterested, I stopped school early, I found something else that I enjoyed. Then sometimes that's a good cue to follow for looking at whether the child might have something also similar.
That was Dr. Ashley Wasana, an associate professor at the Centre for Child Development and Mental Health at the Jewish General Hospital. If you suspect your child has a learning disorder, contact your child's school, talk to the psychologist or their learning center, and ask what the next steps would be in diagnosing your child. And that's it for this edition of Your Health. Again, we remind you, if you missed any of our previous programs, you can find them archived on our website at podcast.ciuswestcentral.ca. That's podcast.ciuswestcentral.ca. You'll find there all the information such as links or phone numbers that we've mentioned in the show. Also, feel free to drop us a line if there is a topic or area of discussion that you'd like us to explore on future shows. I'm Peter Anthony Holder. Thanks for joining us.
You've been listening to Your Health, a podcast of the Integrated Health and Social Services University Network for West Central Montreal. Join us next week for another edition of Your Health.